Welcome to Radi Us, our University of Manitoba Radi Faculty of Health Sciences monthly podcast, where you get to catch up on the headlines from the past month and meet our faculty, staff, and learners making news. We'll also be engaging with our Radi community beyond our campuses, so be sure to listen for alumni and partner voices too. I'm Jonathan Wilson from the Radi Faculty Communications and Marketing team. The Roundup for the month of February 2025 includes stories about Radi psychology researchers, the Martha Donovan Awards, CIHR funding announcements, and more. A new study from researchers at the Radi Faculty of Health Sciences has identified a possible treatment option and greater understanding of recurrent glioblastoma, a fatal form of brain cancer and the one that took beloved Canadian musician Gord Downie's life in 2017. The study, published in Neuro-Oncology, a journal of the Society of Neuro-Oncology, found unique metabolic characteristics of the later stage version of the disease. This discovery could lead to improved survival outcomes for recurrent glioblastoma patients, said corresponding author Dr. Tanvir Sharif, Associate Professor of Pathology and Canadian Cancer Society Emerging Scholar with the Max Rady College of Medicine. Sharif said that 95% of patients with glioblastoma die within 5 years of their diagnosis, and that most of these patients die from a recurrent form of the disease. In tests with mice, his team was able to target the unique characteristics of the recurrent disease to prolong survival using a drug currently in clinical trials to treat Alzheimer's disease. Sharif told City News he is optimistic that their work can provide hope for the 1,000 Canadians diagnosed with the disease each year, with promising results already being found in lab settings.
For this recurrent disease, there is literally no therapeutic option. So I think any further knowledge that can enhance our understanding of that disease, I think is crucial at this stage for the patients.
March 8th is International Women's Day. One way the Rady Faculty of Health Sciences is celebrating is by announcing the latest recipients of the Winnipeg Foundation Martha Donovan Women's Leadership Development Awards. 12 faculty members or students are winners this year. They each receive funding to enroll in a leadership training program that fits with their goals. Dr. Farhana Sharif is a cancer surgeon and assistant professor of surgery at the Max Rady College of Medicine. Her leadership roles include training residents in surgery at and chairing the Surgical Standards Committee at St. Boniface Hospital. Her Martha Donovan Award is funding her to complete a Women in Leadership certificate at Cornell University. She says the program emphasizes effective communication, which is vital for women in surgery.
You know, the operating room has some really unique communication and leadership challenges. It's a bit of a pressure cooker, especially when cases are complex. And while we sort of talk about it in training, nobody really teaches you how to be in a room with multiple leaders and how to shift that leadership back and forth. And I think with that transfer of leadership needing to happen so quickly at times, you really need to be able to adapt your own leadership style.
The other winners of Martha Donovan Awards are attending leadership programs through universities such as Harvard, McGill, and Stanford. The College of Nursing held its largest ever pinning ceremony on February 5th, welcoming 146 new nurses to the profession, including 14 Indigenous students, the most ever in a single cohort. The new graduates received their nursing pin and recited the Bachelor of Nursing Pledge, which was inspired by the 1893 Florence Nightingale Pledge and has been adapted by the university. The graduates will receive their degrees at the next convocation in June. The ceremony was hosted by former college dean Dr. Neetha Dick and included greetings from knowledge keeper Brenda Longclaws, president and vice chancellor Dr. Michael Benarosh, and dean of the Rady Faculty of Health Sciences Dr. Peter Nickerson. Nickerson told the graduates that the faculty takes great pride in the training they received.
You are very well prepared to enter the workforce. I have no doubt about that. All the practical experience, the classroom experience that you've had has prepared you for that. And I think a lot of times we feel, am I ready for the next phase? What's it going to be like as I move into work? You are well prepared. You have the skill sets you need. And you're going to be embraced and welcomed because we're all looking forward to you joining our team of healthcare providers. And it is a team. Healthcare is a team sport. It's our OT, PT, respiratory therapists, our nursing, our pharmacists, our physicians. We have to collectively work together, and I know that you're well prepared for that with the education that you've received.
Tolo Akaloye was co-valedictorian along with Sophie Harms. Originally from Nigeria, Akaloye came to Manitoba 4 years ago to study at UM. He recently started a position at St. Boniface Hospital. In his address, he thanked the college, professors, and preceptors and praised his classmates.
We survived those long hours, impossible exams, and moments that tested our emotional and physical limit. Not only did each of us survive, the best part is that we made it together. We definitely did not just learn the science of saving lives, we learned how to channel compassion into the lives that have been entrusted to our care. We learned many skills such as perseverance, honesty, collaboration, and commitment to patient-centered care. Looking at how far we've come today, I can confidently say that we have all grown into exceptional nurses, and I certainly would not be afraid to have anyone graduating here today as my nurse.
An elder wellness project at Lake Manitoba First Nation, done in partnership with the College of Rehabilitation Sciences, will mark 5 years this spring with continued work on an intergenerational walking path. In 2020, the community identified physical health for older adults as one of its top priorities at a retreat hosted by the college as part of a partnership with several First Nations communities to develop services for the communities based on their self-identified needs. A holistic walking path and fall prevention program for elders was developed by students in the physical and occupational therapy programs. And in 2023, ground broke on the Shared Path Trail, which was designed by landscape architecture professors from UM's Faculty of Architecture. After the path was completed last summer, 13 students from architecture, occupational therapy, and the Max Rady College of Medicine planted 428 trees and shrubs around the path. First-year occupational therapy student Alyssa Wright was among that group.
It was really cool. In this program, we're really encouraged to visit rural communities, and we talk a lot about the need for like OT and other services in rural communities. But I hadn't really ever been to too many. So getting to be a part of building something for them, and like kind of learning about the area there and getting to see it. They had just built a new health center there, which it's right by that, and it's a beautiful building, and just like getting to see all of that was really awesome.
This spring, the development of the space will enter one of its final phases, the planting of natural grasses and medicines. The Max Rady College of Medicine recently held its 15th annual Teacher Recognition and Manitoba Medical Students Association Awards Evening. More than 160 medical students, teachers, faculty, and deans attended the dinner at the Canadian Museum for Human Rights. The guest speaker was Dr. Catherine Tinkham, who earned her medical degree at UM in 1997. She's a kidney transplant specialist who is physician-in-chief at University Health Network in Toronto, Canada's top research hospital. Tinkham said coming back to UM renewed her appreciation for her medical education and for the strong sense of community at the medical college.
When I look back at my time here, I want to guarantee everyone who's a student in this room, you aren't just getting a good education, you are getting a phenomenal medical education. There is something very, very special about this medical school. It is big enough to have world-class science, world-class educators, some of the leaders in the field, but it is small enough to connect students directly with those people.
The awards evening included the presentation of Teacher Recognition Awards, voted on by medical students to honor teaching excellence in categories such as innovation and mentorship. 4 awards were also presented to medical students who have distinguished themselves in the categories of citizenship, global health, community service, and leadership. February was Psychology Month, a time to celebrate psychologists and the vital work they do, including research. To raise awareness of the research that faculty members in the Department of Clinical Health Psychology are working on, UM Today featured the work of Assistant Professor Dr. Christine Chang. Her main research focus is on the outcomes of children and adolescents with prenatal alcohol exposure and fetal alcohol spectrum disorder who are seen at the Manitoba FASD Centre, where she works as a clinical psychologist. Chang also focuses on caregiver and family-related outcomes of families of children with prenatal alcohol exposure in relation to diagnostic process and programming. She told Today that having research data supporting their clinical observations has been helpful, especially when working directly with families and consulting with other clinicians. Another faculty member from the Department of Clinical Health Psychology was in the news for Psychology Month. The research of Associate Professor Dr. Renee L. Gabalawe was profiled by CBC Manitoba. Her research focuses on the mental health of patients as they undergo surgery. El Gabalawe is exploring innovative ways to increase accessibility to mental health treatments, including the use of virtual reality.
The idea was, can we develop a virtual reality program that uses scientifically supported methods and treatments to be able to better support patients? For me, it was really important, though, that all the ideas didn't come from me and the literature, that it also came from patients and people with lived experience.
El Gabalawe told CBC that her and her team have run several studies where they built a virtual reality prototype that exposed people to the operating room environment. To learn more about the department's clinician scientists, visit their website, available in the show notes, umanitoba.ca/medicine/department-clinical-health-psychology. The latest issue of Rady UM magazine has been released. The cover story of the Rady faculty's biannual publication is about the new College of Community and Global Health. When it launches this spring, it will become Rady faculty's 6th college, recognizing the growth and prominence of UM's dedicated work in global and public health. The Department of Community Health Sciences will transition into the new standalone college. Dr. Michelle Dreger, professor and head of community health sciences at the Max Rady College of Medicine, says the new college will allow them to provide new programs, gain greater exposure for their research, and create new and innovative partnerships.
I think it's a really exciting opportunity that, that's going to position a lot of the work that we do within currently the department, now being kind of having a higher profile as a college, will really help to be a good strategic benefit to support all of the initiatives within the Rady Faculty of Health Sciences. So I think it'll really make, elevate that collective presence that we have at the university and then beyond.
The new issue of Rady UM also features articles about UM alums making a difference in our communities and Rady faculty scientists leading cutting-edge research projects. The magazine includes a message from the Vice Provost, Health Sciences, and Rady Faculty Dean, Dr. Peter Nickerson, and notable news from across the colleges. The latest issue of Rady UM is available on magazine racks throughout the Bannatyne campus and online at news.radyfhs.umanitoba.ca. 12 health researchers from the University of Manitoba were awarded more than $9.6 million in the latest round of Canadian Institutes of Health Research project funding. The scientists are from 8 different Max Rady College of Medicine departments, the College of Pharmacy, the Faculty of Education, and Faculty of Agriculture and Food Sciences. They are examining a wide range of topics from reducing inequities in trail use for urban First Nation and Métis people to examining the interaction of dietary flaxseed with blood pressure medication. One of the grant recipients is Dr. Ina Rabinovich-Nikitin, an assistant professor of physiology and pathophysiology at the Max Rady College of Medicine. She and her team received more than $1 million over 5 years to study what could one day lead to new treatments to reduce the risk of heart disease in people with disrupted circadian rhythms. Circadian rhythms are 24-hour cycles that regulate changes in the body, like heart rate and blood pressure. Rabinovich-Nikitin says that when the circadian rhythm is disrupted by things like shift work, poor sleep, or jet lag, it has a negative impact on the heart and could lead to heart disease.
And in this research, we're looking at lipid metabolism. So we found one specific gene called PER2 or period 2. That's part of the circadian mechanism, and that regulates lipid metabolism in the body, which can increase the risk for heart disease. So we're suggesting different approaches to study the connection between this gene, the PER2 gene, and lipid metabolism, and also to develop different treatments to reduce heart disease from circadian disruption.
Rabinovich-Nikitin says that circadian rhythm is a neglected area of research, and they're working hard to better understand its impact on our health. Thanks for joining us today. What did you think? Send us your ideas and feedback to radymarketing@umanitoba.ca. Read more about this episode's stories by visiting our UM Today Rady Network news site at news.umanitoba.ca/network/Rady Faculty of Health Sciences.